Okay, TMJ, pain away. Okay, you've had headaches for a very long period of time. You actually went to the point where you had surgery on your jaw.
Yes.
What did they do?
They cleaned adhesions out of the joint.
Okay, and that helped?
Yes.
It helped, but you still have some headaches?
Yes.
Okay, and where do the headaches tend to be located?
Well, I have two different types of headaches. I have the tension headache, which is on both sides.
Right.
And then I have migraines when it's on one side. I lose sight,
Mm-hmm.
and then I get the severe headache
Okay.
of being nauseous and
Right,
everything.
and you're known to clench?
Yes.
Okay, you know that you clench? Okay, do you tell yourself clench?
No.
Okay, so it's an unconscious habit? Okay, it's an unconscious habit
Well, I'm
called
sleeping.
clenching, which the dentist called bruxism. Okay, why do you think you brux?
I don't have a clue.
Okay, well, when do you brux?
What is Brox?
Grind your teeth, clench your teeth.
Oh, okay. Well, I catch myself during the day working.
Okay, and what's
when I'm
happening when
sleeping.
you're working?
Deadlines.
Deadlines, okay, so you're
Yes.
under
A lot of stress.
Under stress, okay. So you say that when you're under stress is when you start clenching. Okay, and now you also mentioned that you have problems sleeping. Okay, so and that do you wake up with headaches, or did you wake up with headaches?
Yes.
Okay, and did you have a night appliance at one point?
I had 3 different kinds.
You had 3 different kinds. Did they help?
No.
They didn't help, not at all?
No,
Okay.
because with clenching, you still bite down.
Okay.
If you grind, they would stop you from moving your jaw back and forth, but not this pressure.
Okay, good. Okay, so if we went to the cause and you got rid of the initial cause, then you're going to resolve the problem. I think we'd agree with it. I do functional medicine. Okay, functional medicine is we look for the underlying cause and treat the cause so that everything else resolves. Right? So if somebody has poor digestion and we give them enzymes and all of a sudden their digestion normalizes, their energy levels pick up, they feel better, they sleep better, they have more libido, they have more friends, and they have a great life. All because they took a digestive enzyme which got rid of the gas that they had. If you understand what I'm saying.
Mm-hmm.
Okay, so I've been doing TMJ Pain Away for 20 years. And the answer came to me, it just like a light bulb. People clench their teeth when they're under stress. Everybody agrees with that. The dentists give you an appliance so that you're not going bone to bone, and most people clench in the middle of the night when they're sleeping. So they're under stress. When they're sleeping, they're having nightmares or dreams, bad dreams. When they're having a bad dream, they start clenching. Okay,
Right.
Where do you think that habit comes from?
Uh-huh.
Take a guess. Okay, if I
Childhood.
Childhood. Okay, so if I told you it was a habit
Mhm.
and it comes from childhood, I'd go along with that one. Now, where do you think the childhood habit came from?
I don't have a clue.
Okay, well, this is what I postulated. Okay, I saw my daughter. She had a binky in one hand, a binky in the other hand, a binky hanging from here and one from here. A binky is also called a pacifier. And of course, one was in her mouth. And in her crib, she had a couple more. If you took away any one of those pacifiers, she'd start crying. So it hit me. Clenching, that unconscious habit started when you were very early age, called a newborn. Okay, a newborn or a baby, when it's under stress, it's either hungry, wet, tired, or in pain. Right? Now, you're in the car, they're in a baby seat, they're locked in, you don't have, you know, they start crying, what do? Well, the first thing you want to do is stick a bottle in their mouth, and that would work, right? But if you don't have a bottle, and you know that they're wet and they're hungry, and you can't change them, and what do? You stick a pacifier in their mouth, and as soon as they start chewing, they stop crying. And it works for a good period of time until the hunger pains come on enough, okay? But it pacifies them. So as a parent, we hate when our children cry because that means they're in pain or they're hurting. So if we can't fix the problem, hungry, wet, tired, or in pain, we just stick a pacifier in their mouth. Next thing you know, they're crying because they don't have a pacifier. So whenever they're under stress, they want to chew. And if you have and we're designed so you can chew all day. You can chew gum all day long and not have a problem. That's not bruxism. That's chewing. Okay? So the teeth are going in and out like this. Because there's food they never really touch, and there's a squishy response that just says, by reflex, go. And you can just chew it automatically without thinking about it. But in the middle of the night when you're sleeping, there's no food in your mouth, so the teeth are going bone to bone, and they're going harder, 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 and they're waiting for that squishy release, which doesn't happen, so they just keep going harder. And if I keep pushing my arms together like this, you don't see any motion, but I'm pushing really hard. and I do this for about a week, do you think my shoulders are going to hurt? You better believe it. My shoulders are going to be killing me. Okay? So if you start clenching your teeth harder and harder and you do it every night, it's gonna cause pain in this area, and the pain is multifactorial. You know, at first we thought it was strictly the jaw joint. Well, yeah, jaw joint is very sensitive, and that will give you pain in the area of the temples. But the muscles, the masseter muscles and the buccinator muscles, they go into spasm, and when you feel them in there, you feel them to be real tight, and they form little trigger points or knots, and we'll show you the trigger point pattern later. And those trigger point patterns give pain. Pain gives more stress gives more clenching gives more pain, and next thing you know, you have a cycle where you have constant pain. If it goes on long enough, then the TMJ headache, or the bruxism that causes that morning headache, then becomes a migraine. Okay? With me so far? Does it make sense?
Yes.
It makes total sense.
Yeah.
Okay, so how do we stop you from bruxing? Okay, well,
If I knew that, I wouldn't be here.
I came up with a very simple solution. There's two parts to it. The first part is we teach you to stop clenching, and that's what we're going to do right now. Part two is we reduce the stress level so that you don't have to clench. So if we reduce your stress and teach you to stop clenching, you stop it altogether, your life's working better and you feel better. Okay, with people that wake up with morning headaches and tension in the area of the jaw, we're 100% successful. Okay? Now, there's some people that have other issues going along, and we're not that 100%. Okay? But overall, this program is really simple, and just because it's simple doesn't mean it doesn't work. We agree it's an unconscious habit. We agree the clenching predominantly happens in the middle of the night when we're sleeping. Okay? And when we're clenching, because we're having those bad dreams, we wake up with headaches. The headaches destroy our lives, and we just continue clenching. Okay? So, this is how we're going to teach your unconscious mind to stop clenching. Follow me, do what I do. Tap, tap, tap. Okay? And the tapping in the temple is just waking up the unconscious mind, and it's telling the unconscious mind, think about this. Okay? Then massage the muscles that are real tense. And as you're massaging the muscles, you're going to say out loud the following. Say it with me. Relax the jaw, relax. No more clenching, no more pain. Relax the jaw, relax. No more clenching, no more pain. Relax the jaw, relax. No more clenching, no more pain. Relax the jaw, relax. No more clenching, no more pain. Relax the jaw, relax. No more clenching, no more pain. Okay, now, so 10 times you're going to do that. So 10 times you're telling your unconscious mind, relax. No more clenching, no more pain. Now your unconscious mind does what it's told. It doesn't really think. I'm going to give you an example. Okay? You know, you're a parent and your son Joey is right over there and Joey's bad. You say, Joey, you're bad. You're going to jail when you grow up. Joey, you're bad. You're going to jail when you grow up. And you say that to him every day because he's bad. And he becomes worse. And he goes to jail. On the other hand, you say, Joey, you're smart. You're going to college. Joey, you're smart. You're going to college. Joey, you're going to be an attorney. Joey, you're going to be a doctor. Joey, you're brilliant. What happens? He thinks he's smart. He goes right on to college. And he goes to college the same way kids go from elementary to middle to high, because he's been told it his whole life. His unconscious mind is working on automatic. Make sense?
Yes.
Okay. So, here's your training program. Tap, tap. Relax the jaw, relax. No more clenching, no more pain. Joey, relax the jaw, relax. No more clenching, no more pain. Your unconscious mind does what it's told. You have to say it out loud. Now you can whisper it. Relax the jaw, relax. No more clenching, no more pain. But you can't. Silent doesn't work.
Right.
Okay? Now, it's really expensive, and it takes a lot of time. Well, what are we getting at? I mean, to do this takes about 30 seconds. I want you to do it 3 times a day. Okay? So we're talking a minute and a half, 2 minutes max, and in the end result, your headaches are going to go away, the tension's going to go away, you're going to wake up feeling just fine. How quick does it happen? It's pretty dramatic. Usually 1 to 3 days, and the headaches are gone, and then you'll have little ups and downs. Okay? And the reason is, you have to tell yourself every day. So 30 times a day, you're telling your unconscious mind, relax. No more clenching, no more pain. Okay? Now, originally when I did this, I told patients, when you catch yourself clenching, do this technique, and it made a big difference. And I taught it to a gentleman. He was an administrator of Bellevue Hospital in New York City. He was one of these brilliant guys. He retired at age 50 because he had headaches every single day. The only thing that helped him was acupuncture. So he came in for acupuncture. I taught him my technique. He did it. He was supposed to come back the next day. He did it. A week later, I see him up front. I run up front. I say, "Hey, how are you doing?" He says, "I'm doing great. How often are you doing the technique?" Meaning, how often are you clenching, catching yourself clenching? And the deal there was, when you catch yourself clenching, you become conscious of it. Okay? And he says, "I'm doing it 3 times a day." And I said, "You catch yourself clenching 3 times a day?" He said, "No. I caught myself clenching constantly the first day. The second day, it happened maybe 5 or 6 times. By the third day, I only caught myself once or twice. And after that, I didn't catch myself. And I said, I'm just going to keep doing this technique until my mind gets it." Okay? So, a good habit, it takes a lot. A good habit is, you know, you eat ice cream one time and it's a habit. It's okay. But, you know, bad habits, I say good habits take like 30 days to 2 months to get rid of, to acquire. Bad habits are like eating ice cream. You eat it once and you're addicted to it. Okay? So the deal with the technique is the tap helps the unconscious mind get it started. You're telling it 30 times a day not to do it. Add that up over the month, that's a lot of times, and you stop. If you do it for 3 months, the clenching is gone forever. But if you do it for 3 or 4 days, it's gone for the week. And then you're pissed at me because it didn't work. It only worked for a few days, and I say, "Are you doing the technique?" I say, "Nah, it's stupid." Okay? So, if you want to get rid of the habit, you do it every day for 30 seconds.
Okay.
Okay? 3 times a day. 30 times a day, you're telling yourself the end result is no more pain, no more headaches, no more clenching. Okay? It's that simple. Okay? Step 2 we'll do next week, and that's on the stress reduction part. Step 3 is we put it all together. When you do all 3 parts, it works. So, if you have morning headaches and you have tension in the jaw, ask yourself, am I clenching? And you will catch yourself clenching. When you feel the tension, you ask yourself, am I clenching? And then you catch yourself and you can't stop, right?
Yes.
You can't stop. You say, I stop, and you won't stop.
No.
You do this technique, and it dramatically reduces. While you're doing it, you're feeling the spasm in the muscles and you're relaxing them. Now, if the muscles are real tight, we're going to add one more technique to it. What we're going to do is gently open the jaw against resistance. So the muscles that close the jaw are extremely strong, like an alligator, right? The alligator supposedly has 15,000 pounds of pressure, whatever. But opening, the alligator is extremely weak. You could hold the alligator's mouth shut with your fingers like this.
Right.
Our jaw is the same way. Gravity opens ours. Okay? So what you want to do is open 1, 2, 3, relax. And it's an isometric. Isometric means no motion. So if this is my jaw, okay, I'm going to hold it, open, relax. Open, relax. So it's open, 1, 2, 3, relax. So watch. I'll be your hand.
Okay.
Open, too hard, relax. Open, there you go, relax. Open, relax. Open, 1, 2, 3, relax. Open, 1, 2, 3, relax. That was real gentle, right? Did you feel a little muscle contract? Do it again.
Well,
Do it again. Do
I
it.
felt it loosening up, actually.
And so what happens is, if I want to relax my triceps are in spasm, my arm's stuck, I contract my biceps. Okay, so if I push on the biceps, a reflex goes up to the triceps and it turns it off. It's a natural reflex that relaxes the muscles. Otherwise, I'd be doing this. Okay, so as soon as you contract the muscle that opens the jaw, it by reflex relaxes the muscles that close and gets rid of the spasm. So when you're feeling real tense and you feel that, you just go like that 10 times. Open, 1, 2, 3, relax. Open, 1, 2, 3, relax. Very gentle. If you do it hard, you'll actually irritate the jaw. All you want to feel is the little muscle contract. Okay, so to reiterate, when you catch yourself clenching, you do the technique. Okay? You do the technique morning, afternoon, and evening, preferably not in public. Okay? You have to say it out loud. You can whisper if you want to whisper. It's tap, tap. Relax the jaw, relax. No more clenching, no more pain. Relax the jaw, relax. No more clenching, no more pain. It's kind of monotonous. You're self-hypnotizing yourself to stop clenching, no more pain. When it's real tense, You then do the exercise, open 1, 2, 3, relax. Open 1, 2, 3, relax. It's very gentle. And by the 10th time you go back and the spasm's gone. And all of a sudden, you're not clenching. Okay? So become conscious of your unconscious habit. If you already know you do it, just do it. Just do the technique. After a week, you'll feel a tremendous change, but don't stop. Continue doing it for 3 months, and guess what? You'll get rid of it forever. Okay? Now, I say forever. Forever can be a year, it can be 5 years. Somewhere down the road, you may have severe stress, and you'll catch yourself clenching.
Mm-hmm.
So when you catch yourself clenching, at that point, it's like you're driving your car and the oil light comes on. Okay? The oil light comes on not to say your engine is about to seize, it's saying the pressure's low, check it, and you'll be fine. Now if you ignore the oil light, you ignore the stress, then eventually you'll get it back again. Okay? And if you ignore the oil light, your engine seizes. So take advantage of the messages from God. One is too much stress. When you're clenching, it means you're too much stress. Do the technique, that stops this part. Step 2, we reduce the stress. Step 3 is a new exercise. Thank you.